March is Liver Month, and like so many other organs in our bodies, we do not pay much attention to them until something goes wrong with them. Joining us this morning on Healthy Living is Naturopathic Doctor Jacqui Fleury. Good morning, Jacqui.
Good morning. Thanks for having me.
Good morning in studio.
Loving
yes.
it.
Love it.
To be here.
I love it as well. Well, so nice to meet you in studio, Jacqui. And we're talking about our liver this morning. So what are some symptoms we can look out for to catch something before it begins?
It's a great question. Yeah, so typically we don't really pay much attention to our liver and our gallbladder until perhaps you've been to your doctor and they've done some blood work and told you your liver enzymes are elevated, or you might have a bit of right upper quadrant pain. But long in advance of these symptoms appearing or your blood work going off, there are signs such as digestive issues. So you might have gas or bloating or heartburn or reflux. Or your stools might be floating, and that's in part because your gallbladder produces bile, or it's bile that your liver produces, and it's responsible for helping you to digest and absorb your fat. So if your liver is a bit congested or your gallbladder isn't working very well, you'll start to see those symptoms. You might notice changes in your hormones, so you might notice your cycle is more painful, or if you're menopausal, you might have hot flashes. You might notice changes on your skin, so eczema, psoriasis, dermatitis, skin rashes, or maybe a coating on your tongue. You might feel really tired after you eat. So these are all signs that your liver is struggling. It's a little bit congested, a little bit boggy. So you know, the blood work is like your check engine light coming on, and these signs are like going and taking your car for maintenance before your check engine light comes on.
Okay, yes, great example of that, and lots of symptoms to look out for. So what are some steps to take to be good to our liver?
Absolutely. So when we're trying to figure out whether or not our livers may be struggling or a little bit under functioning, there are tests that we can do that can help direct us to underlying causes of what might be causing our digestive tracts and our liver and gallbladder to be struggling. So food sensitivity tests is a really good example. So this can tell you whether or not there are subtle changes or subtle inflammation happening as a result of a food sensitivity. And there are over 250 studies that connect, let's say, gluten intolerance to gallbladder and liver disease. So there's a lot of value to knowing if there are foods that you're eating that are contributing to your digestive tract and your liver and gallbladder being irritated or inflamed. Knowing your vitamin D status is really important, because vitamin D is a fat-soluble vitamin. And you may be supplementing, or perhaps if you're lucky enough to have gotten some sun, you may think that you're getting enough vitamin D, but you may not be absorbing it because your liver produces you know, the bile to help you digest and absorb the vitamin D. But it also is responsible for converting vitamin D to an active form. So again, very much connected. And third would be an omega-3 test. So knowing how much healthy fats you're consuming in your diet, because they can offset the elevated levels of the sort of bad cholesterol as well as your triglycerides, and they're anti-inflammatory for your liver. So, you know, just by dialing in your nutrition and your vitamin D status can make a world of difference for your liver.
Well, great information this morning on being proactive with our liver and keeping that healthy. Thank you so much for chatting today, Jacqui.
Thanks for having me.
Thank you.